We are honored to have Hal Wolf today joining us at the HDC Chat Speaking Series. And I'm going to start with a very short bio about you, if I may. So Hal is the president and CEO of HIMSS, a leading global nonprofit advisor in healthcare and informatics, a visionary thought leader, and you're driving the transformation of the global healthcare ecosystem through the strategic use of information and technology. You bring a wealth of expertise in areas such as digital health, product development, integrated care models, large-scale innovation implementation. Your leadership and insights continue to shape the future of healthcare worldwide. Thank you for joining us today, and I'm truly excited and super nervous to be talking to you.
Oh, Rashida, it's a pleasure, and thank you for having me. And that was a wonderful introduction. So thank you.
You're very welcome. I have a couple questions. I'm going to start with the
Sure.
first one, which is a glance at HIMSS. I have attended, probably you don't know that, but I have attended HIMSS when I was a PhD student at Penn State. Shout
Oh,
out to IST Penn State and to the current dean, Dr. Andrea Tapia, which I'm grateful for everything. And when I attended, because it was my dissertation at the intersection of healthcare and technology, it was like a kid at a candy store. Since then, I have been attending many HIMSS conferences and amazed by the added value every single time. This year is not an exception. HIMSS was packed with innovation. I'm going to focus on the AI part and breakthroughs. What are some of the themes that emerge or topics or technologies that excited you the most, that made the most impact within you?
yeah, it's a really it's never an easy question because I think when you get into the global conference, you have literally over 300 educational sessions going on. You have 1,000 providers of new technology that are on the floor, and you have all these conferences of actual providers that are taking place, and everyone's looking at the elephant from a different angle, right, as to what's going to excite them.
Right.
I mean, for me, I really believe that we're on this um, scary journey, might be called scary, of very unsettled times with excessive amount of change management. And that was talked about quite a bit at HIMSS in a very realistic way. We know in Washington, D.C., for example, that the amount of funding that's coming is going down. We see all this shakeup happening right before conference and a lot since, right, which we were prognosticating. So there were some very, very good strategic discussions coming up about scenario planning that took place at the conference. I thought that was very interesting. It's impossible to look at healthcare today and not contemplate all of the impact on AI is going to have, not just in clinical decision support, but more importantly, in the whole operational view. And how is it going to aid itself in supporting workforce? And then there's more attention to workforce development today than there has been in a very long time. And it's almost long overdue. So I think we've gone from an industry that, change is relatively slow to one that sped up because of the pandemic. And I'm actually predicting that in the next 3 years, we're going to see unparalleled change in healthcare that's going to be incredibly unsettling. It won't be perfect, and it'll continue to evolve. And I think it's going to be fascinating.
It is scary, fascinating, but definitely we cannot ignore AI at this stage or at this point in our lives. I'm when I again I'm gonna go back to my early days. HIMSS stands for Healthcare Information and Management Systems Society. And at the beginning, all what I knew is HIMSS as a conference, and a conference that happens every year in the US. There's some of us that still think that's all what HIMSS is about. Can you, it is true. Can you expand, and some of my colleagues are in the US, others in Europe, Africa. Can you expand a little bit on its global services that HIMSS provides to everyone?
Sure, I'd be honored to. So first of all, you have to sort of kind of go through a history lesson of HIMSS to a brief, very brief history lesson. So if we go back to 1961, that's when HIMSS was founded, and it was at Georgia Tech University with computer science leadership of various departments getting together with this crazy idea that if you began to look at the data and the information coming out of healthcare systems and you started running them through computers and started looking at data analysis and gathering information, it could make a difference, right? So crazy talk. And so that's what really started it. HIMSS grew across academic hospital institutions, really within the computer science departments, trying to support um, all of the hospitals that they were responsible for. And it grew and it grew, and it's great. Then it married up with a exhibition company, and that's what really brought the HIMSS event, if you would, forward, which became and still remains the largest digital health conference and exhibition in the world dedicated to what we do, which is digital health transformation on many different levels. And so when anyone ever walks into HIMSS for the first time or even the second time, they go, oh my God, that was amazing, but it was so much to take in and it was so overpowering. And it is, it's a lot because there's just a flood of information. Now, what was great about HIMSS is that it was named a society. And the reason they chose society versus an association is that an association is usually one particular trade or one particular subject. But they knew a very long time ago that healthcare is all about a society. It's doctors, it's nurses, it's clinicians of all types, it's IT professionals, it's administrative, it's reimbursement programs, it's insurance. All of these components have to come together in order to deliver care. And it's a very complicated global health ecosystem. So HIMSS is about understanding that ecosystems. It operates all around the globe. We now have over 120,000 members that operate globally. When I came in and was fortunate enough to take the realm 7.5 years ago, we had under 80,000 members, about 95, 96% were in North America. Today, we have about 80,000 in North America, so it's continued to grow, but we've added, a ton globally. And so now 2 out of 5 members of HIMSS are outside North America. And
That's
we're going.
amazing.
Yeah, it is. It's been very rewarding. And we've seen tremendous growth in Europe, the Middle East, Asia Pac, and now we're beginning to focus on both South America, the northern components of Africa. And we'd like to go deeper into Africa if we can and further south. We were just about to before the pandemic. The pandemic, of course, rolled back some of those goals, but that's what we're looking forward to in the next 2 years. So we literally have an incredibly and wonderful, rich society of many great minds and thought leaders that come together as individual members, members of their departments, members as a part of communities, which can be either by region or by discipline. And of course, our chapters, which operate in North America as well as India. And then we also call them communities outside of those 2 areas.
This is very rich, and I did not know all this background, by the way. So this is helpful for me and my students and everybody else that is listening. Early on, as I was getting deeper in my research and I started interviewing and doing some data analysis, I came across HIMSS models, framework, whether the EMR adoption or now the AI adoption. And it
Mhm.
was just mind blowing to see that there is a structure that hospitals and healthcare system can leverage as they're moving forward into their technology implementation.
Yeah, this sits at the very core of who we are and what we do. So the HIMSS maturity models, which we're very well known for, are the culmination, and they're refreshed every 2 to 3 years or sooner if needed, are really the aggregated expertise of our members and experts within the industry to say, if I'm going to put in, we'll use an electronic medical record, MRAM, which is our probably our most utilized maturity model. What are my dependencies? How do I move from a fully papered environment to no paper at all? What are the systems that are necessary? How are they integrated? And literally any hospital, country can take this and say, okay, I can design my whole strategy around MRAM. And in fact, you would look in the United States and meaningful use was based off MRAM. When you take a look at Germany, Italy, the UK, Romania, um, Korea, where I'll be next week and signing another MOU on the distribution and understanding their digital health and supporting them, you'll see our maturity models built in, not just MRAM, but also our analytics model, our continuity of care, our infrastructure model. We have a digital imaging model that is there, and all of this is overlaid in conjunction with our digital health index, which allows the system to look at its readiness for digital health. And it helps guide what your priorities should be based upon what your outcomes you're looking for. And what's most important about the maturity models today is they're not just a technical checklist. Almost anyone can do that. And in fact, there are other products out there that are digital checklists. And that's interesting. But the relevancy comes because you're improving quality and you're improving access, and that has a direct patient impact. And so this is a part of the complexity of what we do today, which is why governments and individual hospitals seek our support all the time.
You just took my next question out of my mind about the use of analytics. And as a researcher, as a consultant, as what I call a humble expert in this area, there is still a misconception that analytics and AI is that magic wand that if you plug it, then it's going to solve all your healthcare problems and challenges. What is, and you spoke about it just earlier, the role of HIMSS in demystifying this misconception, showing that there is more to AI, to technology innovation and operationalization than just a technology. And HIMSS has been involved in understanding the critical steps or strategies required for successful implementation of analytics and AI solutions. If you can expand a little bit more on this.
Yeah, I'd be happy to. Well, let me go ahead and solve this misconception. This
Please.
actually is the magic wand that we
I
use
love
in
this.
healthcare today. I keep it on my desk. It's under lock and key at night, but I thought I'd bring it out for you just for this. So this is actually the one that solves all the healthcare issues. It's not AI, but we keep it handy just in case. But all kidding aside, and I do keep that magic wand on my desk because
I love it.
I agree with you. There's a lot of magic wand thinking. I think where what we understand is that any technology is a tool.
That's right.
And there are many great tools out there. We are technology rich as a fundamental world today. But as we're also constantly reminding people, is that any implementation is people, process, and technology. So understanding what you need from a dependency standpoint for AI. How do you set up your governance? Where are you going to use it as a tool? How do you train your people in anticipation of its use? And more importantly, how do you build it into your new culture? There are a couple of incredible challenges which are on top of us now. Again, we have a workforce that is not adequate to be able to keep up with our encounter-based paradigm we grew up with. Truth is, we didn't really have a great encounter-based paradigm to start with. I mean, we always had people that were outside, not getting access. You know, people live in the shadows of some of the greatest hospitals in the world, but it doesn't mean they can get inside it, right? They're in the shadows, but they can't get there. And what we understand with digital health, whether it's AI, machine learning, or just devices like the one I wear on my finger that's pushing data in and about, those are tools that need to be integrated into the systems of healthcare, whether it's at a hospital level, a government level, a clinical level, et cetera. That is where this is all going. And so what we help design is to help healthcare systems whether you're in the C-suite or all the way down into, nursing rounds, whatever the case may be, or even admissions. How do we set everyone up for success the best way we can to take advantage of the technology by also coaching on the people and the process side?
This is amazing. I should probably record, but I am recording this and sharing it with my students and also some leaders that I have the pleasure to meet. You summarized it in a very in a very, I want lack of a better word, a beautiful way, the people, process, and technology, but focusing more so on the culture and on the strategy. It's not again about that magic wand, it's about how do I get everybody working together versus the silos that we know about healthcare. And
Yes.
the other key item that you mentioned is the workforce. I had I would say, the pleasure of running several workshops, whether in the US, Morocco, or the Middle East. And again, there is a need for a workforce that understand why we're leveraging AI. It's not seen as a threat to their job. I'm going to move to the next question, which is related to this culture. With AI, we see a lot of changes in regulations to be able to embrace AI. For example, in March 2024, we saw the AI Act in Europe, the executive actions emerging in the US. How do you see these global frameworks impacting AI adoption since you're on the forefront? And what steps should organizations take to comply with these regulations, but at the same time promoting innovation within their respective healthcare organizations?
Yeah, that is a really great question. And I think it's a question that most of us have been contemplating and thinking about on a regular basis. The European AI Act out of the European Commission, a part of the European Union, was groundbreaking in the sense that it put the first stakes in the ground about what is responsible AI, where should it be utilized, what's the governance. I think you have to start with this basic understanding. Every hospital will inevitably be held accountable from a liability standpoint in the use of any technology that they deploy, and this is true for AI as well. So whether it's built into an application that you're utilizing or, how you plan to utilize your own data ecosystem, depending upon your strength and your capabilities, you're going to be held accountable for it. So setting up the right governance to understanding how AI is being utilized, understanding the sources of that particular tool that you're using, your fundamental indemnification, it's an important place to start. And it does sound like, well, gosh, it sounds like a little legalese. It is. It is because we have to be very responsible about it. We need to remember that clinical decision support, the recommendations that AI puts forward today, is a recommendation. It is not always going to be perfect. It's an evaluation. Well, why? Well, because we have knowledge management at an unprecedented level. There are literally hundreds of thousands of white papers that are produced every single year. So no one person, no one institution can keep up with it. AI can do a tremendous job of reaching out, finding those publications, and creating summaries for researchers as well as physicians, clinicians, et cetera, in order to aid, using the word aid, in diagnosis and the treatment at the individual level. So that's one of the great advantages of it in clinical decision support. But you must recognize again, where did the data come from? What are the biases built into it? Because biases exist everywhere. So there's a degree of caution that comes with it. And that's the part on the AI side that we're beginning to see on the regulatory piece. Now, it's happening as always when a new technology is adapted, a faster expansion than regulation can keep up with. So you look at the flexibility of the AI Act and you say, okay, that's pretty interesting. How much of that will come back in the United States? Probably a lot. When you take a look at GDPR and other things that have been adopted on the European level, we have a tendency to copy it or we have to be cognizant of it in the way that data gets exchanged. What we hope is that data will be responsibly held, that we will be very focused on cybersecurity to make sure that it is secure, and that aggregated, de-identified data can become utilized in models on a global basis and not hardened into silos back in countries again, just because they're trying to protect their own space. And the reason for that is that we will grow exponentially. And the next generation of AI is much more aggressive than what we're currently using because it will build AI on top of AI and start to unlock mysteries for us that we may not even be asking the right questions right now, but it will. And so, just coming from a meeting recently where I heard some of the thought leaders talking about this, both in some large both industry as well as philosophical, which is be prepared. This is coming again at an unprecedented rate, and it's going to overtake the way we currently practice. So, your point you made earlier on the culture side, it's a shockwave coming. This is literally an afterblast shockwave that is coming that everyone needs to be prepared for. And again, this is not a 5-year runway. This is not a 10-year runway. We're talking in the next 2 to 3 years.
This is I'm speechless because it is happening, and even though some of us are in denial, but it is happening in a much faster than we thought probably 4 years ago. Um, you talked about aiding. I had the honor of collaborating while doing a Fulbright in Morocco a couple of years ago with the medical doctor. His name is Amr Mawjoud, and we wrote a paper, well, he was leading the paper, to be honest, about how the technology is augmenting his job rather than replacing. There was a worry among several colleagues that what is going to be my job if the AI is able to identify, change the doses, and do all that. He's he's very knowledgeable and was able to embrace it along with many other medical doctors in Morocco. Now, you talked about several meetings with key players and thought leaders around the world, which is a huge part of what you do. And as much as we envy you having access to all this, and it's you smiling, to all this knowledge from around the world, I am absolutely sure this is not a trivial task of what you do, right? Um, how has your leadership philosophy evolved in a response to these rapid, really rapid advancement in technology, digital health, and AI?
Well, I think one of the, I guess, characteristics that I have is, as someone once phrased it for me, is a childlike curiosity, not a childish curiosity, but a childlike curiosity. So I've always been on the forefront of new ideas and thoughts. I was involved in the development of video on demand in younger years, and because I literally came from the technical side of the entertainment industry as I came into healthcare later on. And when you look up at a world that's rapidly changing, you're either a change junkie or you're not. And I'm a bit of a change junkie. I've always looked and recognized that change is critical. I think people fear the unknown, and I embrace the unknown. I think that's really the mindset we need to be in. People are always afraid someone's going to take their job away. Let me say this about healthcare. We have more than enough responsibility to go around. About 10 years ago, 15 years ago, depending upon where you were, we went through a pretty significant scope of practice change where we recognized finally that primary care was being hammered, that the primary care physicians were doing too much, and that they could actually offload a lot of their work to nurse practitioners and clinicians and allow them to practice at the top of their license. And that was a big change in scope of practice. What is going to happen now is that AI, machine learning applications, are the next big scope of practice change. That a lot of the things that we've pushed onto nursing, clinicians, and even components of physicians will become a part of an AI tool-based ecosystem that then will create kind of a triage, if you would, to allow the more critical cases to get into the hands of the clinicians, the, the physicians, et cetera. And that's what's coming. That's the big change that's there. Why? We have somewhere between a 10 to 15 million person workforce shortage. And if you look at WHO numbers, depending upon which study, by 2030, you're looking at 18 million. So this shortage is real. Secondly, because not everyone can be connected every single moment of the day into the World Wide Web, we're going to see really important hubs of expansion of knowledge management sharing, driven again by AI, machine learning, which is going to help, to your point earlier, and enhance individuals' practices, not take them away. Healthcare comes down at some very important moment to the encounter-based ability of one human to another, looking in the eye, reassuring them, practicing them with the healing hands, and understanding the individual. There are components of this that will never, ever be non-human in its interaction. And the demand in the world will continue to go up because our populations go up, we'll have more pandemics, and people are living longer. And they have a higher disease burden rate than ever before, largely because, well, they're living longer. And secondly, our ability to diagnose disease burden and chronic diseases are so much better today than it was even 40 years ago. So it's not surprising that the numbers go up the way that they are. And I think it's just part of our ability as humans to create new tools that they've never had before and using them in a judicious way. But that's what's on top of us. And that to me is an extraordinarily exciting moment in time.
Had set of questions, but because of your responses, I have now an extra 10 questions, but I'm going to be mindful of your time. Rest assured of that. You mentioned an emphasis on the human being at the center, being at the loop of these technological innovations. And sometimes we forget, we start focusing on, let me make sure this is the best model to be able to predict whether it's diseases, whether it's operational level. And it's not we forget, but we put it in the back burner till something happens. And you mentioned a bit about that human. How can you, what is the loudest voice or terms you can use to never forget that we are human and we want that to be part of our digital transformation?
Yeah, it's an interesting question. For me personally, it was drilled into my head because of the motto of the college that I went to. And the motto of the college was pro humanitate, for humanity. And as a liberal arts institution, there was this constant reminder that our responsibilities as a human were to the humanity around us. And we were talking about today, some colleagues and I, about some of the changes that are occurring even here in the United States. And it's making people look up and say, I think we've lost some of our humanity. Look, we can be as fancy as we wish, and we can have um, great jobs, terrible jobs. The point of the matter is, if you wake up in the morning, the rest of the day is gravy. It doesn't matter who you are and what you are. The real key is waking up in the morning, right? And then we're just human beings. We're here in this little tiny, not to get overly philosophical, but this minute nanosecond, fractional moment in the expansion of the universe to say we exist, we don't exist. What humanity is the culmination of our learning and our sharing. That's the point of our society. That's the point of each and every one of us. And we try to make it better. Let's be good ancestors. Let's be good ancestors for the people behind us. I think as long as we remember that and we approach not just healthcare, but life in general with that point of view, when you wake up in the morning and the rest of the day is gravy, you might be able to do it with a bit of a smile on your face.
I'm going to quote you on that. We have tendency to forget that every morning that we're able to wake up and go and get up and move around. One other thing I'm going to quote you on is you mentioned you are childlike, you have childlike curiosity. Um, when I was at when I was doing my PhD at Penn State, College Information Sciences and Technology, we focus on interdisciplinary work, and that's why I was doing IT, AI, and healthcare. And it would the college and the faculty were pushing for this curiosity because it is at the core of what we do, whether we went to academia or industry, work with huge companies. It's allowing an environment to help you keep pushing and working toward that curiosity. And
Yep.
just like you said, your job, I won't say doesn't matter, but the environment where you work really matters. And if you have a leadership that support that curiosity, we all move forward really fast in a really supportive and actionable, driven with impact to our society. Um, I don't think that is a question, but probably for me, just a reiteration to this curiosity that really I started with and it keeps evolving. And even through this HDC chat series, which is healthcare digital conversions, it was just curiosity. It was how can I get knowledge from experts, global experts like yourself, and share that knowledge with others. So thank you for reminding me about that curiosity that started a couple of decades ago and just igniting that reasoning to wake up and just feel good about what we do and who we are.
Well, I think you were in College Park at, you mentioned earlier, right, at Penn State.
Sicko. Yep.
It's always interesting how those impacts of certain professors around you and certain thoughts hang with you in life. But I think, um, look, we are at a we're always at a tipping point, as humans, right? We talk about tipping points right now in our country and in countries around the world. Humanity has seen much worse moments. We've seen wars that have covered huge amounts. We've seen plagues that took out literally, I think, one third of the population during the Dark Ages and the Dark Plagues. Um, we're much better equipped now than we've ever been. We kind of get mad at ourselves, just based upon our own vulnerabilities as human beings. And we kind of think that from a technology standpoint, we should have solved a lot of these questions. Well, that's just the human nature of pushing forward and, constantly coming up with new challenges. But if you look at the quality of life that exists today on this planet, it is so much better than at any other time that it's ever existed. Yes, we can destroy faster, but we can also heal faster. And so, look, this is the cycle that just keeps going. I think where we have an obligation, in the healthcare ecosystem and the ones in your students who may be listening to this or anyone on the outside, is never to lose perspective of how much we've gained and how to build on top of what we've gained. If you throw things out on an indiscriminate basis, you're going backwards. If you're throwing things out or making changes thoughtfully, you're going to go forward. You'll go forward a little slower, but you're going to go forward for the sake of those around you. And I want to be able to look up one day, and I think we all do. And I think this is why people go into healthcare and the health ecosystem. You want to be able to look up one day and go, I made a little difference. And you don't have to make a gigantic difference in healthcare. The funny part about it is that if you look at an array of degrees and you take a 180 view of the world, left, right, and what's around us in front of us, if you make a 1 degree change, a half a degree change, over time that vector gets very big. And that's what you're trying to do. You're just trying to make a little bit of a change, a little bit of a contribution, and let that sit over time. And it really does make a difference. And if everyone can make 1/4% change, 1/8% change, we add those together, we help humanity across the board.
I'm known to be a bit on the blunt side. Sometimes it helps me, sometimes it get me in trouble. I thought of you, and please excuse this blunt comment. I thought of you as a human being on your own tower that looks down at the other minions. And you definitely proved me wrong today. I've seen you a couple of times at HIMSS conferences, and you talk to me and you talk to other people. I'm like, oh, no, 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 that's not real. It's just because there is the conference. But talking to you and how you embrace the human aspect, how you leverage technology instead of pushing technology, how you look at the entire ecosystem, it's very humbling. And I take that back and I apologize for thinking you're just a leader looking down on us from your ivory tower. So I said it.
Well, I appreciate the confession. Listen, I look up every day and am always amazed and appreciative of the opportunity that I have been given to both influence and contribute. Um, it's a responsibility, it's an opportunity. And I think if any leader gets in a position where they're looking down, then it's time for them to go. But we're just very fortunate, all of us, to be able to participate with each other in this industry. I mean, and I hate calling healthcare an industry because it's really not. We're still very much, it's as someone taught me early on, one of the physicians I worked with, it's as much art as it is science, right? And there's an art aspect to it because of human being to human being piece. And I appreciate your comments. It's very kind of you.
Absolutely. It's really coming from a very good and honest place. So I'm going to share a little bit background about me. I was born in Africa in a very beautiful country, the Northwest, called Morocco, which I invite everyone to go and visit. And it is emerging as a hub for digital transformation across many industries. I'm not
Yes.
going to call healthcare as an industry, but it is. And we see a lot of advances in this area. Back to HIMSS and how it operates in, I've done a little bit of research, I may get some few wrong, operates in Asia Pacific, Europe, Latin America, Middle East, North America, and the UK. There'll be probably more.
Mhm.
You know what I'm getting with this question is, with the
When do I
growing,
get to go to Morocco? Is that the question behind it?
absolutely, and there are a couple conferences I'm going to hit you with that you absolutely should attend
That would
because
be
I'll be
great. I would love
attending.
to do it.
Yeah,
Um,
absolutely.
yeah.
With these, sorry, interrupting you, but with these growing global demands, are there any plans, and we spoke offline about these plans to expand engagements of HIMSS with African countries and
Yeah.
how? If
Yeah, no, I mean it's very high on the list, and actually Morocco has actually come up recently because, as you know, the government there is in the process of investing heavily in their digital health transformation, and we've been asked to participate in different ways. And I was literally asked recently if I could make a trip to Morocco, and it unfortunately butted up against other responsibilities that I had at that exact moment. So, from my standpoint, um, the way that we've tried to approach things at HIMSS is to say we don't want to come in and just like do an event and leave. That's not us. We want to be able to go in and establish a community, put resources on the ground. It takes time. It's about finding the right critical leaders who can help push things forward. And sometimes those leaders sit inside governments, but that's hard. It's difficult because governments change and ministers change. So we need both government and providers, and those special quality leaders who are there from a vision standpoint, thinking long haul. And then we partner with them. We plant the flag, if you would, and we expand. So as we participate across North Africa and swing around, as I mentioned before, we hope to go deeper into what is an amazing continent. I was very fortunate when I first came into healthcare, and this is going back to 2004. I was spending time in South Africa supporting the new government in its fight, not only against AIDS, but about tuberculosis as well, which was really where the biggest concern was coming because we were getting the AIDS pandemic under control in Africa. You can actually see a rebound now in the age of the individuals growing from a demographic standpoint before it went very low and now it's growing back up again and you can see the expansion and the average age per person growing finally at an accelerating rate. But we were most concerned about tuberculosis because immunization was down. That was hitting the townships, and I was a part of a team that was fortunately being asked to come in and talk and figure out what the strategy could be. So Africa is astounding. It's a massive continent. We would love to find the right footholds to push forward. It'll probably start in North Africa, expanding out of the Middle East, Morocco, and expanding across the Northern Africa plain, and then, heading south again. So looking forward to that. If the right opportunity is there, we'll be there tomorrow. If it's not, next week or beyond. But our plan is to absolutely support and continue. We were so close right before the pandemic. We had several ministers of health that had gathered together. They invited us in, and then, well,
Yeah.
things happened.
Things happen. I like your view into not being focused on a region, but focusing on humanity and how can we, unlike other fields, how can we support and help humans around the globe? And by the way, if you need some key players, I don't pretend to know ministers in Morocco, but I know several key players that I can put you in touch with, and they're working very hard behind the scene to make this collaboration happen. And this takes me to probably the next or last question, close to the last question. Since you joined HIMSS, I believe in 2017, HIMSS has grown significantly over the years, thanks to your leadership and visionary strategy. What is your personal, and I know you asked this question during one of the conferences, what is your personal secret sauce for incorporating digitization and AI to better serve healthcare systems worldwide? So the key word is your secret sauce.
Secret sauce. Um, I from my standpoint, having worked in consulting, if you would, and in support of healthcare systems for many years, not just in the United States, but across Europe, Australia, Asia, Africa. What is most important is to understand what's the problem you're trying to solve and the highest priority you're trying to solve for a particular country or a particular region. And the reason for that is that everyone is in different stages of development. Some have built out digital health ecosystems and now they're replacing them. Some are coming at it for the very first time. But what's the problem you're trying to solve? Is it workforce shortage? Is it access? Is it quality? Is it from a health department standpoint or ministry standpoint? Is it a chain of hospitals? Is it an individual clinic? Right. So I'll go back to South Africa. And I remember going to what we would call a field clinic, almost a very singular hospital out in the middle. It was supporting a few townships. And we asked what the sepsis infection rate was inside the hospital. And the physician replied, 0. I was like, wow, that's amazing. How do you do that? He goes, simple. We don't keep anyone overnight. So we literally do everything we can to push people out. And if they do have to stay overnight, they'll stay one night overnight, and then we'll airlift them to another hospital in Johannesburg or something of that nature. But even giving birth, even if it's complicated, they will get the person home that day. Okay, well, that's one way to solve the problem, but it may not necessarily solve the long-term problem at the individual level, right? So
Right.
the point of the matter is that everyone, depending upon where they are, has a different requirement. When Libya fell, Gaddafi fell outside of Libya. I was a part of a team that helped put together a plan for how do we bring digital health to the new government. So we designed a system that was wrapped around just 3G telephone technology. We have a tendency to think, oh, it's got to be 5G. Oh, it's got to be. No, you can do a lot with 3G technology. We work, HIMSS, very closely with the WHO. How do we support ecosystems where the technology level is low and bring public-private partnerships to help support those growths? So find out where you are. What's the best problem to be solved? What are the resources that are available? There's another triangle besides people, process, and technology, and that's requirements, time, resources. So any project has those three requirements. The customer can have two out of the three. So what are the requirements you're trying to solve and in what period of time? And then the resources are going to have to match it, or you got to change one of the other two parameters. It's simple formulas like that. That's how you integrate AI. That's how you think through any technical people, process, and technology solution together. I wish it was a better secret sauce than that, but you know what, Rashida, in the end, it's all about fundamentals and execution and keeping your head and heart in the right place.
I think you shared a magical secret sauce with all of us, the not just students, but all the professionals and leaders out there. Usually we go through an entire chapter, an entire book, or several workshops for several hours to go through these secret sauce. And some of the key players that I had the privilege speaking to is exactly what you started with, is what is the problem we're trying to solve, instead of, oh, I want to use the latest, shiniest object or tool or product that's out there. And you definitely, that's part of the secret sauce, to embrace and look at the context, which you added a lot of value to that. Where are we operating, whether it's at the organizational level, whether at the country level, or whatever that is, while embracing the requirement, time, and resources. Thank you for that equation to be added to people, processes, and technology. Very much appreciated. I could talk to you for the whole day. I could invite you more and more. I know your time is very limited, and your obligations are really across the world. Any concluding remarks that you want us to walk away with? I know usually ask questions about the workforce, about how we can support young professionals at the conversions of AI in healthcare, biases, ethical. There's so many more that we can talk about in this short
Yeah.
hour, but any concluding remarks that we can walk away with today?
No, I mean, well, first of all, I deeply appreciate the opportunity to speak with you and to participate in this effort in the podcast and all the things you bring to the table. Thank you for bearing with me. I
My
know our
own.
schedule changed, but it flows, ebbs and flows quickly for myself as well, I might add. So
Thank you.
thank you for bearing with me. I think that the most important thing I would just lay out for your students in particular is that they're coming into healthcare really at a very cool time. And when we think about change management, just remember that this is a ecosystem that is going through an unparalleled level of change management. So when I came into healthcare 20 plus years ago from a technology standpoint, my boss who I worked with in telecom looked at me and he said, I need to warn you that healthcare is 10 years behind all other technology, and the organization you're stepping into is 10 years behind healthcare, right? And I was coming in doing XP and web services, and this was 20 something years ago. And I jumped into healthcare and was like, oh my God, you know, they're coding in C++. They're doing things that I haven't thought of in years. And so we had to take a step backwards. Well, why the cautionary tale? Well, because we have lives at stake. That's part of it. And second, healthcare took 250, 300 years to get to where we are today. And we're just like leaping now to new changes. That's a lot to absorb. And you have to measure that against the risk, but you just got to always make sure that the measurement against the risk isn't also designed to protect. So never underestimate the culture brick wall that sits inside healthcare. We will figure out all the change in processes to take care of the new technologies. And just remember that technology will now overleap where we are from a change management standpoint. So just be flexible. I mean, it's all about the change management and openness to it. Select your people and select your leaders based upon their change management skills because it's going to be I will call it a fun ride because we're going to gain a lot of ground very soon. So it's exciting. But again, thank you so much for having me.
Well, thank you so much for being mindful of how nervous I was at the beginning. I truly appreciate it. And thank you for the rich conversation, thought-provoking remarks, and can't wait to invite you again in a few months or a couple of years to add more value to this starting podcast of HDC and the conversions of healthcare and
My
AI.
pleasure. We'll look forward to seeing you in Morocco as well.
Oh, absolutely. You have an open invitation. Take care, Hal. Thank you again.
Thank you so much. Be well.